Hello everyone, Assalamualaikum warahmatullahi wabarakatuh. I am Zirayu. In this video, I'm going to discuss about language disorder. Before we go to the main topic, we have to understand first about what language is. Well, language can be defined as a set of symbols used for communication based on their culture. It has 5 components. The first one is phonology, syntax, and morphology as the form, semantics as the contents, and pragmatics as its function. Now, I'm going to explain each of the elements one by one. The first one, we have phonology. Phonology is the aspect of language concerned with the rules that governs the structure, distribution, and sequencing of speech sounds. Syntax is a rule system that governs how words are combined into larger meaningful units of phrases, clauses, and sentences. Morphology is the aspect of language that governs word structure and includes grammatical words, inflection that carry tense. Then we have semantics. Is the aspect of language that governs the meaning of words and words combination. The last one, we have pragmatics, is concerned with the social use of language. Right now, we jump to the main topic, which is language disorder. First is about its definition. Language disorders are a type of communication disorder. It has been variously referred to as language disordered, language impaired, language delayed, or as having specific language impairment. We can say language disorder is a significant delay in the use or understanding of spoken or written language. The disorder may involve the form of the language, include phonology, syntax, and morphology, its content or meaning, which is semantics, and its use, which is pragmatics, in any combination. Currently, children with language disorder are known as SLE. I will explain about SLE at the end of the video. Right now, we have language disorder causes. There are several factors cause language disorder. The first one is a brain disorder such as autism. The second one, a brain injury or brain tumor. The third one, birth defects such as Down syndrome, Fragile X syndrome. The fourth one, problems in pregnancy or birth. And last one, sometimes language disorder have a family history. Next, we are move to the classification. Uskup 1997 declared 3 types of language disorder. The first one is expressive language disorder. Children with expressive language disorder show an age-inappropriate understanding of language. This disorder can affect spoken and written language, has difficulty conveying messages, weak vocabulary, or even grammatical errors. The second one, we have receptive language disorder. Children do not understand language at an age-appropriate level and include difficulties following directions, understanding words and sentences, and answering questions. The third one, we have mixed expressive and receptive language disorder. Is characterized by difficulties with both the production and comprehension of language. At the beginning, I mentioned about SLE. SLE stands for Specific Language Impairment. So, specific language impairment is a developmental language disorder characterized by the inability to master spoken and written language expression and comprehension, or a language impairment in the absence of significant sensory, neurological, intellectual, and emotional impairment or disorder. Those with SLE are not a homogeneous group, but represent a range of different language profiles in the context of normal development in other areas. The cause of SLE is not known, but genetic influences are likely in many cases. Recently, SLE has been recognized as a long-term disorder for many individuals, persisting well into adolescence and adulthood. It has a prevalence rate about 7% and is more common in males than females. Research shows there is a severe impairment in phonological short-term memory. The problem for children with SLE is that they do not move through the optional infinitive stage as quickly as typically developing children. And how do we predict SLE? We have several factors to predict it. The first one, we have genetic factors. Family history of language or considered language recovery learning disorder should be a risk factor when predicting the future from an early language delay. The second one, we have environmental factors. Conversational styles of parent-child input and variation in linguistic input. And the third one, we have neurobiology. Brain structure in children with SLE have been found to differ in volume and symmetry form. And after discussing about language disorder is and its causes, now we are going to discuss about the risk. The first risk is subsequent reading in academic learning difficulties. Half of kindergarten children with language disorders have identifiable reading and learning difficulties in later primary grades. The second one is impact on social participation. Children with language disorder have lower quality of friendship and participation in social activities than children with normal development. The last risk is increased risk of social anxiety. Children with language development disorder have a greater chance of experiencing excessive fear during socialization in the age of 19 years and anxiety symptoms due to socializing activities at the age of 31 years. That's all my explanation about language disorder. I hope this brings benefits to all of us. Thank you for watching and bye-bye. Assalamualaikum warahmatullahi wabarakatuh.